Assalamualaikum viewers, welcome back to my YouTube channel, and today we will discuss the cytomegalovirus. So as the blue surrounding is present, blue walls, so this reminds us that it is a DNA virus, and as this all the scene is taking place inside of a room, so its replication occurs in the nucleus. And as you can see that this Hermes is shown, which is we have discussed in the various videos. So this Hermes reminds that it is of the herpes family, and these mans are showing with T and B signs, which represents that it infects the B and the T cells. These cages are shown, which reminds that it also infects the macrophages. The sleeping man reminds that it is latent in the mononuclear cells, that is leukocytes, and this immunocompromised patient with the immunocompromised gene, it reminds us that the virus become reactivated in the immunosuppressed patients. And as the torch you can see here, it reminds us that it is one of the torches infection, and it is transmitted via the blood, sex, saliva, urine, and via the breast milk. And as you can see the children, so this reminds us that it is one of the most common fetal viral infection, and it presents with a blueberry muffin rash or the petechial rash, just like the congenital rubella. और इसको याद रखने के लिए ये हमारे पास blueberry muffin cakes present है. So it reminds us that it causes the blueberry muffin rash. Along with it causes the hepatomegaly and the jaundice, which is remembered by this yellow cow with the liver. And as this ये बच्चा आप लोग देख सकते हैं कि इसने अपने कानों पे हाथ रखे हुए. So this reminds us that it causes the sensorineural hearing loss, and the ventricles are shown in the brain cap. So it reminds us that it causes the ventriculomegaly, that is periventricular calcifications. Also, along with, you can see this man is falling off. So it causes the mental retardation and seizures due to the intracranial calcifications. And this sign, that is 80 to 90% sign, it reminds us that most of the 80% are the asymptomatic. And high risk of the congenital CMV occurs in the second trimester. And now these small babies in pinkish, and this is with water, it reminds us that it also causes the hydrops fetalis, that is heart failure, which leads to the edema. And the number one sign on his shirt, it reminds us that it is the number one cause of the mental retardation from the viral infection, and number one cause of the sensorineural hearing loss. Which patients are mostly affected? That is immunosuppression patients, HIV, and the transplant patients. So this butcher you can see with various types of the meat organs, it reminds us that the organ transplant patients causes the CMV pneumonia. So इनके लिए हम क्या करते हैं? We use a Buffy coat culture, which is reminded by this Buffy coat culture हम use करते हैं with anti-CMV antibodies. Here this man, it is holding the immunocompromised gene. So it reminds us that this is the AIDS patient. It also infects the AIDS patient when the CD4 count is less than 50. It causes the CMV retinitis, which is represented by this pizza pie retinitis भी कहते हैं and CMV retinitis भी कहते हैं. Along with this pink sheets, which reminds us that it causes the CMV esophagitis, and along with these cells, it reminds us that it causes the colitis. And it is different from the herpes because जो CMV है, it is singular, deep, and linear. And this one you can see, it is holding some Ol's pictures, which reminds us that it causes the Ol's eye inclusion bodies under the microscope. What is the treatment? This green basket is showing that the ganciclovir is given, and fuscarnet is remembered from the fast car when there is UL97 gene mutation. Okay, people who are not immunosuppressed, they have also the chances of the CMV mononucleosis. Like this patient, this mother, you can see that it has a pinkish pharyngitis. So CMV mononucleosis occurs, and it is presented with sore throat, lymphadenopathy, and fatigue. But when a monospot IgG test is done, that is negative. As you can see that this is the holding the test. So monospot IgG test is negative. So here ends the cytomegalovirus. Hope you like the video. Like, subscribe, and share with your friends. Thank you for watching.